Welcome to Micro Health Talks, where we bring you insightful discussion on all things that is health and wellness. As women, we often take care of others. We dedicate ourselves to take care of others with lots of love, uh, dedication, and endless strength. But, dear woman, when was the last time you really took care of yourself? Happy Women's Day. This Women's Day, let's take a moment to take a pause and reflect and think to take care of ourselves as well. Joining with us today is Dr. Fadwa Mustafa, obstetrician and gynecologist at Alaziya Medical Center, Qatar. Dr. Happy Women's Day.
Happy Women's Day to you. Happy Women's Day to all women out there, moms, sister, and grandmoms, all women all above the world and all around the world.
Thank you, Doctor. Thank you. Doctor, to start with, what is Women's Day to you in the perspective of a healthcare practitioner?
Well, for me, women or moms is a ladies that a mother, a daughter, a sister, a grandma, a working mom, a hard working mom, not only working mom. So for me, women's means not half of the word. For me, it's all the word.
Wow.
Yeah.
Okay. So speaking about Women's Day, we are trying to emphasize on women to take care of themselves as well, because women are often being categorized as that sect of people who don't really take care of themselves, but they take care of everything and everyone around them.
Yes.
Doctor, why do you think women often don't take care of themselves, or they are always late even to start with the medical care? Compared to men, women always delay 50% in taking care of themselves with regard to healthcare as well. So why do you think is that?
Well, one point I think that being a woman and being a caregiver and always think of make people happier, then she think of herself. This delaying many times she visits a doctor, or if she feels sick or her child sick, she will prioritize her child to go first and check and seek medical advice, and then she think of herself. But the opposite is true. If the mom is happy, if she's healthy, she will take care of the family, of the work, of every other aspects of life in the better way. So I think in the Women's Day and this March month, I love the March month because the Women's Day and then the 21st is the Mother's Day.
Yes.
It's a month and a year to remind women to prioritize themselves, to put themselves out there first.
Yes.
So it's a good chance now to tell them to just memorize them about their health. They need to go and visit their doctors in a routine checkup. They need to do many steps. We're going to discuss it all through this podcast.
Yes.
Just to improve, promote health of men and women's health.
Okay. So, Doctor, like speaking about this, these days most of the women are working. Irrespective of their working or their housewife, women are always occupied with work, be it mental or be it the hassles they come forward with. Doctor, how do you think they can balance the life with regard to work and health?
Well, first of all, a woman needs to have a very supportive, if she's a married, of course, supportive partner and supportive children, supportive family. If she's a work mom, they have to know that she's doing double work. It's not only taking care of kids and family, but also taking another aspect, the work outside with her own responsibilities, and she have to do it. I mean, twice strong and twice positive, just to be compared. I'm not talking anything about men, but just to be compared that she's as good as men. While I think the power and the energy she's spending is even more than men's. So women, they need to prioritize themselves. They need to think of I love to say this, pray, eat, and love.
Yeah.
So the movie is really touching me.
Isn't
we
it?
need these three aspects in your life.
Yes.
If you eat healthy, balanced diet containing all the balanced diet, protein, the fat, the carbohydrates, you take your all minerals and vitamins, and you just have promote your mental health. You think of your mental health. You love your children, love your husband, love your family. You work, but in a balanced way. Don't overcome something in conscious or other thing. And then of course, the prayer is the spiritual part of your life. We need to have a thing to believe in. You need to strengthen your faith, and life is full of faith. If you believe in yourself, you're gonna reach, and you can reach a very nice, happily life, inshallah.
Wow. What a definition, doctor.
It's a definition.
I'm inspired.
Yeah. Be happy.
I hope this inspires all the women who is watching this as well.
So
Yes.
mental health, I think many neglecting the mental health. They think
Certainly.
it's something, no, we don't need it as a fair thing to do in our life.
Mhm.
But ladies need to promote their mental health. How we can promote mental health? First of all, let us say that depression and being sad and avoidance, this will put you in very high risk of many trouble, increasing the risk of cardiac disease, strokes. All of a sudden, suicidal tendency increase with especially new moms with overcoming the child, the
Postpartum
baby.
depression.
Exactly. And because it is not well aware about in our community, especially our community, they think this is just being spoiled, or she's no. We need at least to book classes of maternity to teach you how you deal with the newborn. This is a new life
Yes.
you are dealing with, and it's really struggling. The dealing with new baby, disturbing your sleep. It's sleep depriving in the first 6 weeks. Might be continuously of crying, and you don't know. You feel sometimes you are under taking care of your child. While the thing is simply, this is the nature of the new baby, newborns. This is the way they are dealing in the new life. How they, got occupied and got knowing how is the life around them. So the mothers need to be teach. She needs somebody to support her during this time. A mom, a sister, a close friend, a husband, of course, to take care of all these things.
Yeah.
Then you need to think of writing daily journals. Whatever bother you today, just write it down.
Reflections.
Take
Yeah.
it out. Don't keep it inside you. If you write it down, you will feel relieved. Even if it's partial relief, it's helping you on the long term. You can also start like new hobby. Every day, think of something new. Try to know how to draw. Join a group, trying how to play pianos. Go outside nature. Just sitting outside in nature, look at the sky, or meditation, yoga, it will help you. All this will release the stress we are suffering of, and seek, of course, medical advice. If you think that this is above you, this is above your tolerance, it's not a shame. There is no shame of being tired. This is normal. You are a mom, you are a human. Even if you are a super mom, you have a right to be tired. So say I'm tired, see, I need help. So they should ask you for, they should help you. And they should give you whatever you need, as support and help.
Certainly. So, doctor, you touched the points of mental health, physical well-being.
Yeah.
So, doctor, speaking about well-being and mental health, when is the right time that a woman should think about, the routine checkups in their life?
Okay. The good thing that we always ask, the good medical system, we have what we call it a family physician. The family physician aim is routine checkup. Any deviation from your normal way, normal habit. If you wake up in the morning, you have a headache, then you took a Panadol, you are not okay. The headache is still persistent. This is not your normal. Don't ignore it. Simply go on your doctor visit. He will be the best one to tell you this is normal or not.
Okay.
Then the routine checkup with your doctor. Within this routine checkup, there is certain visit will be scheduled for you. There is certain visit for annual, we call it annual screening tests. For a woman, our concern is the mammogram. Or ladies of age from 40 to 65, they need to do this mammogram every 3 years after age 40. If they have a strong family history, any problem, then they need to come earlier to do this one. And then the doctor, again, he will be the one who schedule you for this type of screening.
Okay.
There is also Pap smear for us
Absolutely,
to search for cervical cancer or reproductive age and sexually active ladies. They need to do this screening. Again, the family physician will be the one to start the basic screening. If anything problematic or anything he's doubtful, he will refer you to the higher level to follow.
Okay.
So all the time or accurate time of visiting, it depends on the patient's family history. It depends of your risk around you. Depends of your natural health. Then they will take you from there and they will schedule you accordingly.
Okay, doctor. Like as women age gracefully, they go through different phases of life, different changes in their body, different changes mentally. So, addressing that regard, like what are the tests or what are the routine checkups?
Elderly ladies are of a special concern because the being menopause, especially for our party, being menopause, ladies need to prevent things. and to see screening. In the prevention, the main concern is the osteoporosis. Because the hormones that producing our normal cycle, when it disappears, it affects our bone mineralization, bone building, let's say. So the bone will be reduced in intensity and quality of the bone. This will cause some trouble and fractures and problematic to the elderly, affecting their walking and activities. So the first thing is to prevent osteoporosis. The patient need to visit her doctor. There's also, again, certain screening will be done to determine the bone density. Is she's on high risk of this problem or no? And then the preventive medicine. We give some tablets, vitamins. Exercise is the best treatment for the exercise is the best for everything, including the osteoporosis. So elderly ladies from osteoporosis or subsiding of cycle, we need this. The menopause also, we need to check, as I said, mammogram for her checking. We need to check certain brain problem, the Alzheimer, the dementia's problem. She needs also to follow with her doctor to check her vitamins level, and if there any problem, again, he will be the best to deal with her. And as I said, they will emphasize more in exercise. 30 minutes a day of walk can help you really, can improve your cardiac health, can improve your respiratory health. So it avoids you from many problems that might happen with simple things.
Simple tips.
Yeah, exactly.
Great. So, doctor, apart from all this, what else do you suggest? Like, what diet do you suggest?
Diet, again and again. Diet, if you are a healthy and active lady, the balanced food is the best.
Okay.
Containing more protein. The protein is of the plant origin or animal origin. Both of them are okay. I usually love to draw like a circle and make it like 3/4, but different side. The big portion is big protein. Then the vegetables and fruits, and very small, tiny part for the sugar. You need sugar at the end. We will not deny this, but in a small amount and in a good sugar type. Don't take processed food. Don't take high sugary drinks. This is all affects your health. So we need to avoid this in our daily intake and the daily food.
Yeah, doctor, this year, Women's Day beautifully coincides with the holy month of Ramadan. Yeah, which is also, speaking about self-reflection and meditation and again, diet, everything coincides very beautifully together. Yeah, so it's doubling the delight. Doctor, what recommendation or suggestions or advice that you would love to give to the women who are practicing fasting in this holy month?
Well, fasting itself, it's help you improve your health. There is our Prophet Muhammad, peace be upon him, said if you have a disease, you fast. Because fasting can help you to release from some problems. Those diabetic, for instance, if the diabetes is type 2, what we call it, just you need tablets, the fasting is not bad for you. You can try it. But if you are taking insulin, then again, you discuss it with your doctor, you might be avoided from taking that one. But overall, fasting can promote your health. The best advice I'm going to say for patients or for ladies fasting, that the way you break your fast, don't go straight away for full food. Don't go straight away for a juice. Start by dates. The dates is the type of sugar is simple sugars that alarm your pancreas to release the insulin in a small amount after a long period of fasting. If you go straight away for taking high meal full with sugar or for proteins or others, you alarm the pancreas to refuse. He produces too much insulin. Then this is very bad for your health. So start your breaking fast by a nice way, by a smaller amount of dates, water, milk. Do your prayer and come back, eat something warm, and then you can go on from there. So avoid the rush of eating. The late sahur also, or the late food before the Fajr prayer also can give you strength to the prayer fasting day. Prayer, of course, this is for faith and for spiritual life. It will improve your health again. So fasting overall, no, I think is the best thing to be done for health is fast.
Isn't it?
Yeah.
Okay. So let's emphasize on that. And Dr. coming back to reproductive health, especially for women. So what are the tips that you would love to give to the women of this century or the 2024 era?
Is a very stressful era coming in advance. Take your minerals, take your vitamins. You need it even if you are taking good diet. Still, we are working very, very toughly out there. The stress is acting like now the mental health is the priority in all health aspects. So you need to take your at the minimum preventive measures, do the exercise, take your vitamins, sleep early, join a group that makes you happy, join a group that you can discuss your issue without any judgment, just relieving, talking and relieving yourself. The girls of reproductive age, the vitamins, not the vitamin, I mean the food around us is affecting our fertility. Nowadays, I'm seeing too many young ladies suffering from problem of fertility.
Infertility.
When we search for a reason, the all common thing is the food they are taking, the fast food. When you say this is my way, I'm working. So even if you are working once a week, make your schedule, put the healthy diet, healthy food, cook it for yourself and take it with you to the work. If you take like 3-4 times a week healthy food, and it's okay, 1 to twice, okay, we can survive that. But more than this, you're affecting truly your health, you're affecting your future fertility. Again, do your routine breast screening. This will be done for all ladies just after the cycle every month. By normal checking, she will find if any issue in her breast, if any problem, especially if she have a history of breast cancer. Do also the other routine tests with your doctor, ultrasounds every like 2 to 3 months. Do also the Pap smear, as we said, the mammogram, all type of screening tests you should do. The reproductive age nowadays, we are encouraging the HPV vaccine, papillomavirus vaccine, because again, the cervical cancer rate is very high.
Increasing.
And we know that more than 90% of the causes is because of HPV virus, the high risk one. So by simple screening, you can prevent yourself. Take the vaccine will help you. The annual, of course, the newly COVID thing now. So also the vaccine, the COVID-19 vaccine, we encourage people to take the other seasonal influenza vaccine, the reproductive age, specifically the tetanus vaccine, diphtheria and pertussis, we call it the triple vaccine. They need to take it and they need to take the booster dose afterward. So discuss with your doctor what is the vaccine I should take, and he will be the best to guide you from there.
Okay, so it's all about being aware. Awareness is the key.
Exactly.
Yeah. Okay, Dr. Like speaking about infertility, the rate of infertility is very much alarming. So you told the causes. Like, what do you think are the preventive measures that women can undergo?
Oh, it is very big, but I think I think just by taking care of yourself and your other partner health, avoid harmful habits. Many men with the smoking affect significantly the nature and the quality of the semen. So avoid bad habit, avoid alcohol, avoid sedentary lifestyle, just eat, sleep, no activities, all will affect you. And not only fertility, will affect your health
Overall,
journey.
Doctor, speaking about sedentary lifestyle, sedentary lifestyle has become a part and parcel of like the humankind now. So coming to a female, to what extent females have been affected by the sedentary life?
I don't think very much, because one ladies working at home. At least, the daily activity, she will have like 2 to 3 hours working the normal
routine.
Routine. This is sort of exercise. Yes, we need to 30 minutes minimum of moderately exercise, but still, a woman's not like me. For instance, nowadays in Ramadan, at this time, I'm sure 90% of men sleeping in the rooms. Ladies are roaming around the kitchen and other things to prepare for iftar.
Isn't it?
So no, salute to the ladies. They are not sedentary at all.
They don't fit in this
category. This not category, but men, they need to change. They need more exercise. They need more activities. And as technology advanced, there is, even if for those sedentary and don't want to move, they can do exercise. Some paid, I see some muscles, machines, just to put and work the machine without your effort. But at least the muscles are working out, moving. So if a last option, we can go there and do this.
Okay. So, Doctor, I know you propagate a lot on mental health. So, what is your personal tips for mental health?
Mental health. Don't sleep sad. If anything bothers you, take it out.
So don't
How
go
you
to
take
bed
it
that.
out? Write it down.
Okay.
Write a note. Have a good friend that she won't bother if you pick a phone on the middle of the night and just talk to her. No need to find solution.
Okay.
Just taking those bad emotions from inside can help you. I think all Arab communities need to rethink of psychologists and some sessions. It will relieve you. We need to take the stigma of this one. We need to talk friendly, talk openly without any judgment. Somebody who said she's going to that or she's going to this.
Yeah.
We need to change this mentality. We are now on very advanced 20s, so halas, enough of being sad of some mental problem. It happened, it is there, and there is really mental problem happening and going on there. So we need to take care of mental health by more awareness about mental problems that might happen, and we need to educate people to accept people with mental problem and don't add to them. At least don't add to them. If you cannot help and you cannot cope with them, don't add to them.
At least.
Problem.
Yeah. Dr. Like worldwide propagandas, and there are moments to encourage mental health, like or to face people who are affected by mental health, to face and to overcome. There are a lot of support systems around the world. Yet consulting a psychologist or consultation is still considered as stigma.
Yes.
Doctor, why do you think the main reasons of these?
This is need from higher authorities. I mean, the higher levels of legislations to be changed.
Okay.
That if I am as a doctor now, I somebody knows that some problem, they withdraw my license, for instance. They need to avoid the punishment of being ill. Mental illness is the same like any other illness. So we need some strong legislation that's telling you can be mentally ill and you can have your job, you can have your work, you can have everything as normal as others. Same if you have cardiac disease. Yes, they will have some certain consideration, will not put you in very stressful, for instance, work, but they will not provide you any deprive you from your work or from your job or from your maintenance that you are using.
Certainly.
So if this, I think, at the first step happen, then the rest of the things will go smooth. The awareness will increase. People will feel free to speak and talk. The mentally ill person have very free and friendly way. He can talk. He can express his problem. And it from small problem it won't be very big because he just kept it inside or he's afraid. So we need to work on that, I think, strongly and more intense on that thing.
Doctor, I believe this is the strongest message a woman can give to the womanhood on Women's Day.
Yes, exactly. Don't feel alone. Don't think you are alone. We are all around you.
Yes.
You need to talk.
Yeah, and that is a great thing, Doctor. Like to be heard, like someone being there to listen, or like when I'm expressing, someone is there to hear. That's a great thing. Like to have some. You often mentioned about your friend. I suppose you have such a great friend.
Greetings to her.
Yeah. So we wish happy Women's Day to your friend.
Yeah, exactly. Happy Women's to you. Happy Women's to your family. She knows. Whom I talk about, she knows herself very well. Because yes, I don't feel any shy or any judgment anytime I feel in trouble, and vice versa. She called me and I call her, and yes, we don't solve the problem of the words, but we feel relieved. And this is the main steps in
you ease your burden.
Exactly.
Yeah. So, like concluding that message is, we encourage every woman to have a strong female friend.
Yes.
Very we can pour out everything when someone will be there for you to be heard.
Yeah. If not, I usually say daily there. Just make a note, write it down, and believe me, in a month after, you just come and read that and you will laugh.
Oh, silly.
Yes, yeah. What is that? Why you will make it a big at that time, because the problem at that time will be very huge and it occupied you as a whole. But when time passes, it heals you. You grow up. You feel you are above that problem. So you feel this is silly. Why I took times and the next future, if same situation happen, you won't take it the same way you took it.
Isn't it? Yeah. Well, there's a lot of tips, Doctor.
Yeah, see?
Okay. So I want to keep on listening.
Yeah.
What more?
What more? A friend, you said a good friend to talk with, and a good health, a good sleep,
good food.
A good food.
Yes.
Stay with kids. if you try it once, you will feel amazed. Just go in the playground of any garden and just sit around the kids. Watch them first and try to mimic them, or just do whatever silly thing they are doing.
Okay.
They will look at you at a stare of what she's doing, and then they will join you.
Okay.
And it is totally different. Take you differently. You will have very bright brain afterward. You will feel happy. You will feel really you go back to your childhood.
Yeah. Is it?
And this is the same like I was thinking. For me, I feel it is my own meditation way.
Okay.
So stay with the kids. Kids will help you. Yeah.
Okay. So, Doctor, we addressed the top points, but like wives, mothers, and big with kids. What is a message that you would love to give to the single woman out there?
Okay, ladies, you're gonna be a mom soon. Start preparing yourself from now. Don't fall in the same mistakes. I mean, you're up earlier. Fall in. You are this generation, mashallah, is a brilliant generation, very, very open-minded, and they read a lot, they know a lot. The life around them is easier, not like us. So get use of that from a beneficial way. Don't use the technology in take you back. Technology to make you advance. You should go above whatever technology gives you now. You need to promote your health. You need to promote your brain. Read more, experience more, talk more to friends. Don't be just within these iPads or phones nowadays. Use them if you are staying alone with that. Use them. Hear a podcast like ours, for instance. Read the book, take experience, talk to people, others around the world. You will gain more experiences. You will be more open-minded. You know others' problem, so at least you will be a part of solution by trying to put your input on that problem or that situation whatsoever. You will be more oriented about your world, so you will love your world more. You will love your life more, and you will do more in this to make it more and more bright for you and for you.
Wow. I am running away from my topic. Like I wanted to emphasize more on health, like in the perspective of OB/GYN, but then I am stressing more on mental health.
That's it. It's very easy. I feel that we are not. I mean, even the paper I'm preparing, nothing. I feel the talk goes smoothly because we are talking about our own selves, our lives, our women's sisters, daughters, all. It touched every one of us. All ladies around there, I think they're gonna be touched by this. But this is the simple life for all of us.
True.
Yeah. True. So that's why it goes very smoothly. Alhamdulillah.
Doctor, what is a message that you would love to give to the men in women's life?
The women, we are not there to fight or to take part of you. We are partners. We are have to do same things together. One hand cannot clap, but two hands will give you a very loud voice. So be our other hand, be our support. Listen to women. They are really stronger than you believe. So when she said anything, listen to what she said to you, and give help, give support, and life will go even more beautiful than it before if you just listen. We need listening all. Just listen.
Just listen. Because we speak a lot.
Yes, we speak. No, they don't hear. We speak less, but they don't listen.
Like, why is that? So we speak more, and then
I think this isn't their YX1 thing.
Let's blame that.
It's nature.
Yeah, it's nature. And we accept the way it is.
Exactly. As the way we accept, they should accept us as well.
Certainly.
And ladies really pass through too many different, even within a month. The monthly cycle disturb your hormones and your, well-being to nobody can believe that can happen, and there is certain disease now called premenstrual syndrome, because it really affects your health to an extent that ladies will be absentees from their work because it affects you significantly. So there is nothing that we are spoiled or just doing this for no reason. There is problems, so listen and take care of us and just be supportive during that period of time. And I think education is the key of this. All men there need to know about us, especially those underlying. Yeah. That's it.
So it's all about awareness, being educated, being heard, being told.
Yes.
So, Doctor, with all these years of experience, with all these countries that you have been,
Mm.
what is the best advancement in healthcare that you have witnessed? Is the best benefit for women? What do you think?
The best for women.
In these all years of advancement that you've come across?
Well, I think that the new artificial intelligence is gonna act significantly in our life and in our medical field, to an extent that I don't believe that the human part will be deviated from that,
Certainly.
but the operation that can be done by somebody, just you put the data in and
Yes.
let him, and the error rate is very less. I think it's gonna be revolutionary.
Yes.
So yes, the robotic thing, I think is significantly will affect the future of the medical field.
Okay.
Yeah.
Great. So, Doctor, this 2025 years slogan or the theme for Women's Day, International Women's Day is Accelerate Action.
Mhm.
So, what is that one action that you would give as a message to the woman who is watching this to accelerate?
Mm.
What they should accelerate on?
I think the for working moms,
Mhm.
we need certain rules or already the maternity leave, extended, which is really very good, because a mom leaving her child after 6 weeks of delivery, this is a cause of depression by all means.
Isn't it?
So now, I heard it's already extended leave. So we need more rules, more things on this part, supporting working moms.
Yeah, there are certain countries who have an official leave in a month for this menstrual cycle.
Mhm.
So, what is a comment on that? Like, do you think every country should accept such kind of rules, or institutions or
Yes.
companies should?
Yes, I think yes, for menstrual, for the pain, especially for women working in multi maybe nationalities or men and women's societies, it's embarrassing for her, first of all.
Mhm.
Secondly, it is painful. There is pain during
Yes.
this. So I think putting rules, accepting leaves without problem that why leave, what is the name of
Yes. Yes.
Even my patient, when they came, when I wrote the cause of leave, they will ask me to write different diagnosis, because for instance the HR, he's a male, they don't
Okay.
want him to know that she is cycling, for instance. So we need certain simple changes. Can submit the sick leave for a female, for instance, or female submitted for female.
Yes.
Will help. Or no need even to write it as a sick leave for a minister, just day off.
Day off.
A day off. It's help and will not affect the work, and will affect the lady herself in doing things.
Yeah. So let's wait for such revolution to come across.
Yes.
Globally.
Yeah.
Let every woman have that privilege.
Yes, globally.
So,
Ladies, they are what you need globally. Blank.
because you have said enough anymore for all of us to come.
Yeah.
So, Dr.
I think this is globally. If here or outside, women need to be heard all around.
Yeah, to be heard. That, like with that strong message,
Yes.
to be heard, and women to be told, like. We hope there comes days where there is no barriers for you to be heard, like you just say and you're being heard.
Mhm.
And with the message of this 2025 Women's Day, to accelerate action, just accelerate it, whatever the actions that you have. Prioritize yourself.
Yes.
Prioritize your health, prioritize your mental health, and stand up for yourself. What more?
Stand for yourself. I would say, stand for yourself.
That
That's
is
a very strong message.
Stand up for yourself. So once again, wishing all the women out there happy Women's Day, and dear men, this Women's Day. What would you like to say, Doctor? Would you like to add anything to that? Okay. So, dear men, this Women's Day, gift your loved one or the woman in your life the gift of health. As Dr. rightly advised, the gift of being heard, be there, and happy Women's Day.